This is the church's new AED with a cabinet for storage. So this is what it will look like when we finally mount the storage cabinet and AED in the church. At this point, we can approach our cabinet, grab the handle, open the cabinet, grab the AED, remove the AED from the cabinet, and carry it to wherever we need to carry it to. Attached to the AED is this little accessories case. We can remove the accessories case from the AED if necessary. And I'll show you the contents of the accessories case. So inside the accessories case, without opening the plastic, we have a razor used for shaving a hairy chest before you stick the pads on. We have a rescue mask that you can use so that you can keep your body substance isolation intact if you have to breathe for somebody. Here on the front of the package, it shows you we have some non-latex gloves. We have some scissors for removing clothing. Remember, you have to stick your pads to bare skin, so you might have to remove clothing. And we have some Paul's antibacterial wipes for cleanup. And it looks like it has a towelette in there if you have to wipe away water or sweat before you put your pads on. Alright, so if we grab our AED, there are some pediatric pads located in the back that are not attached. You can see there's an expiration date here of 2017. Keep in mind that all AED pads have an expiration date, so we need to always monitor when our pads are going to expire. So if we open up the box that contains our pediatric pads, we can see we have our plug-in connector that's kept in a little plastic bag here. Again, the expiration date is labeled 2017. On the front, we have a picture showing proper placement for these pads. These pads are designed for a child 0 to 8 years of age or less than 55 pounds. You can see you'd stick one pad on the front of the chest and you'd stick one pad on the child's back. Alright, so if we get to our AED, we can see we have a green check marked here, which means the AED is good to go. We have expiration tag hanging out the front for our pads, and we can see the adult expiration pads that are connected to the AED are for year 2020. So if we go ahead and open the AED up, release these straps here, open the top cover, and you can see here you can actually use this top cover to place under the shoulder pad, under the shoulder blades of a patient to keep their airway open. So you can actually slide this piece underneath the patient's shoulders. And again, our adult pads are pre-connected to the AED and they stay connected at all times. We have the expiration date, year 2020, and again you have a picture of how the pad should be placed on the patient. Alright, attached to our adult pads, again we have a little towelette which you can use for wiping a patient from moisture, sweat, or water, or anything other liquid. We have a pair of scissors that you can use for cutting clothing. You have a CPR face shield for giving breaths to a patient to try to maintain your body substance isolation. You'd have to open the package up to get your pads out, which is what you see on the picture here. Okay, so your pads are pre-plugged in. To turn the AED on, you just hold the power button on.
Adult pads. Automatic defibrillator. Unit okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
Alright, so after you attach the pads, the AED would analyze the patient's heart rhythm, and if a shock was called for, it would tell you to shock, and the shock button.
Attach defib pads to patient's bare chest.
Shock button is right here in the center, and you would just press that to defibrillate the patient. Make sure before you ever press the shock button that you make sure no one else is touching the patient, because the shock can actually go through the patient and touch anybody else.
Attach defib pads to patient's bare chest.
The shock can go through the patient and shock somebody else who's touching them. So go ahead and turn it off. So I would encourage everyone to stop by the AED case once we get it mounted. I would encourage you to open the case up and take the AED out and look through it just like I did on the video. Of course, making sure to put everything back. But make sure you familiarize yourself with the contents of the AED on a regular basis, so that when it comes time to use it, or if there's a time to use it, we know exactly what's in it, where it's located, and how to use it. So again, we can check the battery by looking at the check box here saying that our AED is good to go. And if we want to test it, we can turn it on.
Automatic defibrillator. Unit okay. Adult pads. Stay calm. Check responsiveness. Call for help.
And the audio voice tells us
Attach defib pads to patient's bare chest.
that the AED is okay, and it tells us what to do. So I'm going to leave some paperwork or some training materials with Jenny, and that way everybody on the AED team can see her and check the materials out and take them home and look at them at your own on your own schedule, and then you can return them back to Jenny so that everybody can have a turn. But it's real simple. There is a CD and a DVD. The CD contains like the manual and the documentation for the AED, and then the DVD, which is in this side, actually contains some training videos. They show you a scenario and how to work the AED on a patient. So definitely worth checking out to familiarize yourself with this AED. In addition, we have the operator's guide. This is a one-page guide to how to use this AED, and again, it's definitely worth looking at to familiarize yourself with the AED that we have. So see Jenny and get this material so that you can look through it.